Good morning, everyone. I'm Seba Aljomaa. I'm a pharmacist and a PhD student in Semmelweis University and Center for Translational Medicine. My vision is to improve the quality of life in oncology via new approaches, and my mission to find the best interventions, the digital health interventions for cancer patients. And we are working on two projects regarding the digital health interventions. And please let me introduce my first project, comparing the effect of digital health interventions on the quality of life of an individual facing cancer by conducting systematic review and meta-analysis. And because of the burden of cancer itself and also its treatment, it could cause an anxiety, pain, and different symptoms for cancer patients. Standard care, unfortunately, has many barriers. And for example, we have the distance. So we are looking for solutions. Technology is widespread, especially among adolescents. Because of that, we could depend or think about the solution using technology. During the COVID pandemic, we noticed that digital health interventions emerged more. So WHO recommendations have been published on 2019 regarding the digital health, which is expected to improve the quality of life. So our aim is to investigate the efficacy of digital health interventions for oncological care. We have two main categories, mHealth depending on mobile phones and also the eHealth depending on information technology. Now we ask this question. Does eHealth and mHealth change the mental and physical health outcomes of cancer patients during therapy? Let's compare the digital health interventions to the standard care for outcomes like mental and physical outcomes, pain and anxiety, quality of life, and etc. Our hypothesis that these interventions will improve the outcomes, the physical and mental outcomes of the cancer patients. So we conducted the systematic search in these databases using search key of 3 domains. Starting with about 25,000 articles, ended up with 203 eligible articles for data analysis. And during this journey, now we are on the phase of data analysis. We have finished the analysis of the first category, which is the games category, and the analysis of virtual reality, mobile application, and web-based interventions is ongoing. And let's start with the outcomes, quality of life change after gaming interventions. We are comparing within intervention groups results in 5 studies. We are using the standardized mean difference because it takes into consideration the variety of these studies and outcomes, especially that these studies are so heterogeneous, using different games and heterogeneous populations. So we are seeing that SMD is the best and appropriate tool for this purpose. And if it's above 0.8, it's the best. Because it's gonna be large, which means that the quality of life, which is our first outcome, gonna be better and higher. But unfortunately, because it's so heterogeneous, so it's close to be high, and the confidence interval also is wide. And our second outcome is also quality of life, but difference of differences. We are comparing the quality of life in 3 studies between the experimental group and the control group before and after the gaming. Also, the result, the SMD, is 0.2, which is low in this regard, and the confidence interval is wide, and the heterogeneity is also in this case high because of the heterogeneous studies. But we still need more investigations to support our hypothesis that the gaming interventions could improve the quality of life of the cancer patients. And for the third outcome, which is fatigue score, also we used the SMD to compare the results or the score of fatigue in 5 studies, also within the intervention groups. And in this regard, also, the heterogeneity is high because the studies are heterogeneous, and it's not significant as it's shown, plus that the SMD is also 0.2 with a wide confidence interval. And I would like to highlight that in these studies, these scales using the reverse way, which means that higher fatigue or higher score not means higher fatigue, but means less fatigue and better health status. But we still need more investigations. Our strength that many of the studies are RCTs with high quality, and also many measurement tools developed in this field. But for the limitations, we have many qualitative studies using interviews and semi-interviews, heterogeneous studies, so it's difficult to compare them with small sample size mostly. So the inclusion of gaming interventions has the potential to improve cancer patients' quality of life, and we are looking for implications for practice, age-specific gaming interventions in oncological care, and also disease-targeted and population-targeted interventions. Also, we are looking for RCTs with high patients number, focus on more homogeneous target populations. And now I'm gonna introduce my second project, which is investigating the distracting effect of tablets, virtual reality, and analgesic cream during regular pricking of childhood cancer patients, which is an RCT. We are in the very beginning of this study, but I'm gonna introduce the concept of it, that children with cancer, unfortunately, are suffering not just from the disease itself, and also from pricking at least once a week. It's painful, it causes fear and distress in children, and now we still use some ways for pain relieving, like analgesic creams, but it takes time. We have some more advanced technology for it, like, for example, VR glasses or iPad, but it's still a limited source. But virtual reality glasses are a novel immersive technology with the capacity to distract the patients from their pain, so we aim to define the most effective distracting technique to reduce pain and fear in childhood cancer patients during regular pricking. We ask this question, which is the most effective distracting technique in this regard? Our population, pediatric cancer patients undergoing pricking, we are comparing tablets, VR glasses, and also local analgesic creams with standard care. Our outcomes like pain, anxiety, fear, quality of life. So we believe that according to our hypothesis, the use of VR glasses is the most effective in reducing pain, anxiety, and fear in cancer patients in childhood undergoing pricking. We are looking for the clinical implication of these expansive interventions in the oncological care. All in all, we are working in this field, the digital health interventions. It's a trend in science, and we are looking for more and more results to support the hypothesis that it's gonna make the quality of life of cancer patients better and their life maybe more happier at some way. So we are still working on the results of the first project, which is the systematic review and meta-analysis, looking forward to also work more on our RCT to get more and more results for the cancer patients. At the end, I just want to thank you for your patience, and being a loner is hard, especially if I lost the code, but still we believe in the holy curiosity for looking more and more for scientific results. Thanks, Albert Einstein, and sorry for losing the code. Thank you.
Thank you very much for the excellent presentation. The topic is also very exciting. What is not clear for me, what kind of games did they use during the studies?
Okay, thank you for your question. Basically, for the cancer patients, we could use a different kind of games. It could be an exer game, which means exercise plus game, so games to improve their physical activity, like Wii devices. And also there are some games, they are designed for cancer patients. It could be an educational game, for example, to kill the cancer cells or whatever. So it could be educational to make them more sure about the treatment and their condition. What is the cancer, what is the treatment, and I will be better or not. So it could work on the mental and physical outcomes.
Congratulations on your great presentation. I'm just wondering if there is any data in the included articles about the staging of the cancer, like at what stage are these kids, like are they actually enjoying these games? And also like what kind of cancer do they have?
Okay, thank you for your question. You're asking about the stage of cancer and also basically the population in the studies are heterogeneous. So you could find different cancer types. Sometimes it could be just solid or hematological or mixed. And the other point is about the staging. Some of the studies, but not in the games categories, are focusing on the advanced cancer or cancer with metastasis or chronic pain. So basically, it's not defined in all studies. You could find the stages, but they didn't depend on it. Thank you.
Thank you.
Thank you.
Congrats for your presentation. I'm not sure I completely understood, that's why I'm asking you. So after these gaming interventions, how was the quality of life and fatigue measured? Were the patients exposed to the same questionnaires that you compare them with, or how were they measured actually?
Okay, thank you for your question. Basically, it depends on the scales, scoring the quality of life using different scales. It's not the same in all the studies, and also fatigue scales. And basically, we are looking for the improvement depending on the scoring, and any improvement regarding to cancer patients is good in this situation. So the questionnaire are given to the were given to the patients at the beginning, and then it could be in the middle of the study, then the end, or maybe many follow-ups. But basically, we focused in our plots on the beginning and the end of the study. Thank you.
Thank you for your excellent presentation. My question is related to, I think, both of your topics. So I would like to ask about the addiction, whether they have measured it, that the kids get addicted to the gaming sessions, or would you like to measure it in your RCT as well?
Thank you for your question. Basically, do you mean that they are addicted for playing games before starting? Okay, basically in the literature it haven't been mentioned because it's not, I would say, the usual kind of games. You know, like it's an educational one. It could be a cheerful environment, especially for kids, but the games are not just for kids. So the populations also include in one of the studies patients where the median age is 50 years. So it's not just about kids. But basically what they focused on in the studies is the impairments that it could be, or it could prevent playing the games, or if the patient is tired, especially that they're gonna use their physical activity. So it's also depending on the timing. Like, for example, you could play just 1 hour a day. So if I'm trying to think about addiction, so I think it's not allowed to play all the time. Thank you.